Well, welcome everyone. I'm Catherine Boyle with Key Ministry. Thank you so much for joining us today in our Wednesday webinar series. Today we're focusing on mental health, and we are very honored to have Shannon Royce, who is the Director of Faith-Based Partnerships for the U.S. Department of Health and Human Services, as our guest today. Shannon has led a tremendous effort over the past couple of years that has resulted in a guide for faith communities called Compassion in Action. And we've shared this a couple of times in our social media, but today we're going to go over it in more detail, and we're just delighted to have Shannon join with us. So Shannon, welcome to our conversation today, and thank you for taking your time to join us.
It's my pleasure, Catherine. Thank you so much for the invitation. Good to be with the three of you.
Thank you. Thank you. And we are also joined today by Key Ministries President and Founder, Dr. Steve Gersovich. Steve has been very involved with the effort that has gone into creating this document from a team that has been working with Health and Human Services for several years now. So Shannon, if you don't mind, just briefly describe a little bit about what you do at Health and Human Services, because
Sure.
that kind of role may be very new for people
Absolutely.
who are joining this conversation.
Happy to visit with you. I have some slides, and there's one slide that covers that. And so do you want to go ahead and start that process now,
Sure,
Catherine?
that would be great.
Perfect. So we're going to talk today about the Compassion in Action Guide. It's a guide for faith communities who are serving people with mental illness and their caregivers. This guide was created over the last couple of years in partnership with stakeholders just like Key Ministry. And my name is Shannon Royce. I'm the director of the center. And yes, I have COVID hair. Look at the difference between the picture and my long hair now. It's kind of funny. Okay, next slide. To get to your question, Catherine, the work of the center is to build partnerships with community and faith-based organizations to serve individuals, families, and communities in need. And one thing for you to know that I think a lot of our faith-based friends don't know is that this work was actually originally started under George W. Bush back in 2001. The office had a different name than it has now, but he established the center back in 2001, worked through the entire Bush administration, continued through the entire Obama administration under a different name. And then when President Trump came in, we got our third name. So we are now the Center for Faith and Opportunity Initiatives, but that's such a mouthful. We go by the HHFS Partnership Center.
Excellent. Well, I'm just curious, mental health is a large part of our world with Key Ministry, but honestly, I don't think many people think that that is a big focus of the federal government. But just based on what I've seen being with Key Ministry for a couple of years, there's been a tremendous effort at the federal government level to help not only shed light on the issues around mental health needs for individuals and their caregivers, but also for the church community. So I'd like to hear in your words a little bit about the impetus for getting this kind of group together that HHS has convened the last couple of years, and also
Sure.
What led to producing this document for faith communities.
Absolutely. Well, I think it's important for our audience to understand that there are really two divisions of HHS that work significantly on this effort. The first is the Substance Abuse and Mental Health Services Administration, another government mouthful of a title. It goes by SAMHSA for short, and SAMHSA has the responsibility for all the programming and grant funding and clinical work that goes behind serving people with mental illness and people with substance use disorder. So SAMHSA does the program side. They're the subject matter experts within the government. Our work is to take the expertise of the government and engage faith and community partners in those efforts, really to expand the network of service to people living with mental illness and to serve their caregivers. The Compassion in Action Guide was really born of meetings that we started a couple of years ago, where we decided we needed to pull in and build bridges between four main groups. We were concerned to connect government with clinicians, with the faith community, and with caregivers. Because the reality is people living with mental illness are in some way engaging with that group of people. They have clinicians who serve them. They have family members who live with them and work with them. And the government has the program support that comes behind the needs that need to be met in their lives. And so we began a series of meetings it's been almost 3 years ago now, of bringing together those groups of people. And the Compassion in Action Guide really was, the impetus for that was a meeting we held in May a year ago. And Steve was a part of that meeting. We held that meeting to bring together a diverse group of faith people from around the United States, across the nation, across a number of religious perspectives and backgrounds, to ask them, what do they really need to know and understand in order to engage in serving people with mental illness? And this document was really born of that conversation.
Well, yeah, and that's just, that's an outstanding effort. And I think that just, from an individual perspective, I think governments don't always get the benefit of the doubt in caring about issues like this. So it's really encouraging to hear that this kind of effort has been going on, behind the scenes for many years, not just the past couple of years. And, Key Ministry obviously works directly with churches and families, but that's so important. And we're so grateful to hear that the government understands the value of the faith communities in resourcing and supporting the families who are living with mental illness. Because I've said for several years that your doctor doesn't have an ongoing relationship with you, and the government doesn't have an ongoing relationship with you, but your church does, and your church
and your
really,
family. Exactly. Your church and your family are the ones who are there way more often. Your clinician, if you have a clinician who provides medication to you, you might see that person once a quarter. And if you're in any kind of counseling, you might see that individual once or twice a month. But the reality is your family is with you regularly, for many people on a daily basis, and your faith community has the opportunity to create a real sense of belonging for you.
Right. Absolutely. Well, so I know that this document, it's tremendously well done. So I know that the document has a number of principles. So if you'd like to just go over the principles so the viewers can see what those are. And please feel free, if you're watching this, if you're a participant in the webinar, or if you're watching this on our Facebook live stream, feel free to submit questions, and we will work those in as time allows with the conversation.
Perfect. So the next slide, we broke this down into 7 principles of compassion in action. Our whole goal in creating this document was to try to nutshell what faith communities needed to know in order to do what they needed to do. And it started with these foundational principles, 7 principles of compassion in action, because compassion that's just an emotional feeling really is not helpful. It's when we move compassion into action that we actually step into the lives of people living with mental illness and serve them. And so here's the nutshell of those 7, but we'll go through each one very briefly individually because I do want to leave time for questions. Next slide. We broke it down into the 7 principles, and each principle has action items and practical exercises so that faith communities can really work through what does it mean to do this principle of the inherent dignity of the person. So there are specific action items in the guide, and then there are practical exercises for each step. The next slide. So the first principle is the inherent dignity principle. This is affirming that every single person, no matter their diagnosis, it doesn't matter if they are experiencing a mental illness, every person has gifts, experiences, and abilities to contribute to the community, to bring to bear to the community. And the whole goal of this principle is to help us understand as faith communities that people with mental illness are living and breathing and working in our faith communities. They're there, and we just need to open our eyes and be aware of them and look for the gifts that they might contribute to the community. Next slide. Principle number 2, the illness principle. We find that in the faith community, there's a lot of disagreement about what exactly mental illness is. And Steve's the psychiatrist, so he could get into this a lot more. But there are many things that are called mental illness, and some of them are more biological in nature. For instance, serious mental illness like schizophrenia or bipolar disorder or major depression tend to have a very significant biological factor. They're often genetically hereditary kinds of things, and that is a significant part of that particular diagnosis. But there are some other diagnoses, perhaps PTSD, the trauma-related kind of response that might be more environmental than it is biological. And so what we say in this principle is mental illnesses are illnesses, they're chronic health conditions, but they're very complex. And so there's an interaction between the biological, the psychological, and the environmental that is really complicated, and we need to honor that reality in dealing with mental illness, not see it as just sin or wrongdoing or not praying enough or not reading your Bible enough. Right. The last thing I'll say about this principle is that this principle is dealing with those who really have mental illness. This isn't dealing with what I would term the worried well, who really are not sick. They're just going through a hard season in life. And so it's important to distinguish between those who are experiencing mental illness and those who just are struggling with some season of life. Next slide.
Well, if I can just jump in here real quick, sure. I think it's really helpful for churches to understand the illness aspect, because if you can give something a name, then you can get help for it. And so I think that it's a hugely helpful approach for churches and for families as well.
Absolutely.
To be able to tackle things head on instead of just assuming that it's that lack of faith element that,
of course,
that perhaps churches, may have historically defaulted to. So.
Exactly. And this slide really, this slide was created from the American Psychiatric Association nutshell of what to look for in mental illness and what signs there are. Obviously, pastors are pastors. They're faith leaders. They're not medically trained. But this is a slide that was created to try to give a clue to faith leaders about what the observable categories are, and then what the observable examples of those categories are. So just to pick one, the thought patterns logic covers concentration, memory, situational understanding. So if you have someone who is expressing racing or disconnected thoughts, or seems to have bizarre ideas, or is responding to voices or visions, that person may be showing symptoms of a mental illness. And so that is an example of the kind of extreme you might see if you're really dealing with mental illness. We'll let Steve talk about that more when we come back to him. Let's go to the next slide. The caregiver principle, I think, is so critical, particularly for your audience at Key Ministry. The caregiver principle recognizes that mental illness doesn't just affect the individual with the diagnosis, it affects whole family units. And we try to look at this from a perspective that says it's not just the individual with mental illness who is isolated. Often living with a family member with mental illness, the stigma can be so significant that the family can become very isolated as well. And so we are calling faith communities to recognize that in this principle and to encourage and engage providing care, support, and love to caregivers as well as to the individual with mental illness. Next slide. The fourth principle, the professional assistance principle, recognizes that there are different lanes for different people. So your faith leader has the lane that provides care and support and encouragement, but they're not the diagnostician and they're not the treatment provider. If someone is living with mental illness, they need to be referred to a clinician or a medical professional who can diagnose their condition and put them on a treatment protocol. And it's important for the faith community to understand that their lane is to continue providing that care, support, and encouragement to the individual and family, even though that person may be in a relationship with a clinical provider. Next slide.
One quick thing here. Someone has asked if this information is available in a booklet or somewhere online, and the great answer is yes. It's a phenomenal booklet. We have linked it on our website already, but we will provide a link to it in the description of the video, both on our Vimeo and YouTube channels, as well as in the Facebook post once the webinar is completed. So just
perfect.
For a little
Perfect.
while.
And our last slide tells where you can get it from us too. So we'll get it to you.
Awesome.
So principle number 5 is the treatment and medication principle. And this principle, again, very critical when you're dealing with psychiatric conditions. Again, some of them are more biologically based. And those that are more biologically based are likely going to involve medication protocol as a part of the treatment picture. But different conditions require different kinds of responses. Again, this is where Dr. Steve's expertise is so significant, and we'll talk about these things with his expertise. But when you're dealing with chronic health conditions, it's a lifelong condition that requires lifelong management, and psychiatric conditions are just like other chronic health conditions like high blood pressure or diabetes that require ongoing management. So the faith community in this principle is acknowledging that they will work with and encourage their parishioner to work with that treatment protocol so that that patient, that parishioner can do the best that they can do. Number 6, the complexities principle. I honestly think this is my favorite of all the principles because the reality is individuals living with mental illness and their caregivers, those who love them, are dealing with very, very complex things. They are rarely black and white. They're usually so complicated that to even try to talk about them with the stigma that is often associated can be really challenging. It's often challenging just to live through the experience, going through a difficult time with mental illness, but then having to try to explain it to people who don't understand can be just difficult and part of the loneliness as well. So this principle, the complexities principle, calls for the faith community to simply acknowledge and recognize that there's a lot they don't know. There's a lot that they don't understand. And this principle calls them to engage in relationship with those living with mental illness and their caregivers with humility, empathy, and compassion. Because if you don't engage with humility, empathy, and compassion, you can end up doing more harm than good. And folks living with mental illness already have challenging lives quite often. So the complexities principle is really critical for the faith community. And then the final one is the hope principle. And this principle, the bottom line of this is who better can support someone living with mental illness or their caregivers with the hope that they need to look for tomorrow to be better, to look to move towards stability and maintaining their life in a way that allows that individual and the family to flourish. Who better to provide that hope than the faith community? Hope is not something that the clinician can provide. Hope is not something, quite often, sometimes you'll get hope from your counselor, but the reality is hope is more of that inborn faith kind of principle that the faith community provides so beautifully. Next slide.
Yeah, that's excellent. I think that I love the term wholeness, because that comes from the Hebrew word for shalom, for peace. It's really about working towards having that sense of completion in your relationship with God. And so all of this, just ties together so well for someone who's struggling with mental illness. Maybe you will not have a cure in your lifetime. God can certainly do that if He chooses to. But we can all, strive for shalom or wholeness in our lives.
Absolutely.
So,
a couple of other things I'll just mention that are a part of the guide. We do have an additional resources section and appendixes. So something just very simple that we put in here of what to say and what not to say when you're dealing with the dignity of the person. You want to speak to them in a way that affirms their dignity. And so this one pager is just what kind of things affirm dignity and what doesn't affirm dignity. Next slide. And then we have some templates that are referral templates so that faith leaders, as they're trying to figure out who would I refer to if a need, when a need comes up in my community, we put in some referral templates so that you can actually complete these templates and have your list prepared so that when that family comes in your office that needs assistance, you're able to refer them to someone you trust. Next slide. Then we have other mental health connection resources, and this is really broad. The federal resources, national organizations, video, training, caregiver resources. There are tons of resources in this. I think we have about 8 pages of resources out of the 44-page complete document. And so this will be a great resource for folks. Next slide. And these are the various ways that you can reach us. Our YouTube channel is youtube.com/HHS Partnership Center. All of the videos that we've done, all the webinars we've done, Steve joined us for one. So all the work we've done on mental health to this date is there, and we will continue to be doing more work on mental health, and those YouTube videos will be there. So those are all ways you can connect to us.
Well, wonderful. Well, just a brief reminder, if you're watching the webinar either as a participant or on Facebook Live, feel free to share comments or questions. We've gotten a couple expressing how wonderful all of this really is. And so I'm sure a lot of people are going to be accessing the information as a result of this conversation. But I just wanted to give Steve a second to jump in here. He's also on the call just to see if there's anything that really stands out to him as a psychiatrist with how important this is from a psychiatrist perspective, because this is designed for churches, but faith communities may be referring to, this Steve Gersovich in their community. And so, what value or, what stands out to you, Steve, with this document and how it can be helpful to churches?
Well, there are a lot of things that are really good about this. And I'm sitting here thinking that I wish we had had this 5 years ago, because it would have saved us an awful lot of work, in terms of pulling together resources. So a couple of things that come to mind that when we talk with churches about mental health inclusion, we talk about 7 strategies. And one of those is in providing practical sorts of helps. And from having worked for a long time in community mental health, one of the things that we talk about a lot is the notion of natural systems of support. And, and again, churches and places of worship, very much fit that bill, because there are lots of kind of practical things that families need that, unfortunately, because of the way perhaps our mental health system is structured or the nature of the resources in their community, that families would have a difficult time accessing. So that some of the kinds of things that we have seen churches do, and what this document helps point folks to, would be to resources, to organizations that have developed some innovative kinds of ways of supporting people. So for example, we are aware of lots of churches that provide free respite care, to families who have kids with developmental disabilities as well as serious mental illness, because that's oftentimes a service that families have a very challenging time being able to access. One of the things that we've talked about a lot is the notion of supporting people in crisis, that when someone is admitted to a psychiatric hospital, that the church be prepared to respond to that in the same way as if that person was admitted to the hospital, for having cancer or a broken leg or having
Right.
some sort of surgery.
Right.
And the notion that that maybe families who are struggling with this could use a casserole. And that, because like when you get sick, one of the things in sort of the more evangelical Christian tradition is that you tend to get like lots of cheesy potatoes and casserole.
Yes.
That's one way people step up.
Mhm.
And it's encouraging people to think about going ahead and doing that, for the folks in their I think the other issue is that there's research that shows that, particularly in the South and in the Midwest, people who have a mental health issue or families who have a mental health issue, the church is oftentimes their first point of contact,
Yes.
as opposed to calling a mental health professional
Mhm.
or like a local mental health agency or a psychiatric hospital.
Mhm.
And so that, it becomes critically important for churches to have some concrete kinds of resources and to be able to put
Right.
together a strategy for how we're going to respond to people in crisis. And,
Right.
with COVID and everything else going on, there's been a lot of that. And, if you're, again, like half of our churches, for example, a Christian tradition in America, serve under 100 people. And this topic could potentially be really overwhelming. And so one of the things I
Absolutely.
really like about what
Mhm.
the folks at the Partnership Center put together is that in one place, there's pretty much all of the information available that you would need to support people. It doesn't feel so overwhelming, and there are very concrete, actionable steps that any church or synagogue or mosque or other place of worship can apply that's going to make a real difference and meet needs in the lives of their people. And so, hats off to Shannon and the team for doing that. It's absolutely wonderful.
Thank you, Steve. I think you just touched on something that really is important for our audience to understand, and that is that as a federal servant, my role is to serve people of every faith. I am a Christian, but my role here is to serve people of every faith and no faith at all. I serve all of the American people, and our goal is to equip faith communities of any kind with resources to serve those in their community who are struggling and experiencing mental illness.
So Shannon, one of the things that is kind of neat about what you guys have done is, again, I had an opportunity to meet, and it was extraordinarily helpful just to appreciate the diversity of the leaders there, from different ethnic groups, from different faith traditions, that are all marshaling resources to try to support families in need. What are some of the coolest things that you've seen, churches or other places of worship doing, during your time at HHS that has been impactful and met real needs?
Yeah, I think there are a number of things. One of my favorite things, Steve, that I've seen is what you just mentioned, and that is that this is an issue that really does unite the whole country. This is not a blue or red issue. This is not a left or right issue. This is an issue that really unites across the entire political spectrum and across the entire religious spectrum, racial spectrum. I mean, this mental illness touches the lives of people across the country from every walk of life. I think what we've seen in the midst of COVID is that it is also touching many people. The anxiety, that sort of general anxiety, has been really widespread, even among people who don't have a mental health diagnosis. There's just a a sense of anxiety, I think, among even people with typical neuro systems. So that's something for us to all keep in mind. I have heard of a number of faith communities doing some interesting things. The Church of God, or excuse me, the United Church of Christ has a pretty robust system. They focus a lot on suicide prevention and talk very widely about suicide prevention and their efforts there. We have seen the Bless program that is out of Wheaton College that I can't remember what what that acronym stands for right now, but Wheaton reaches the predominantly evangelical community, and we've seen engagement on that Bless program. So we're making progress. I think we're still pretty early in the game, Steve, on that front. But the goal of the guide was to be an introduction for faith communities. And for those who are already involved here, you know, we all know about the work that Saddleback Community Church has done, Rick and Kay Warren, and the phenomenal ministry that they have developed around mental illness and serving individuals and caregivers living with mental illness. But they're such a large faith community that their reach cannot be, is going to be overwhelming, I think, to that little church or little faith community with 100 people. So our goal was to make this simple enough that even that small faith community with 100 people can step into the space and begin to take steps to serve families living with mental illness.
So one of the things that I've heard in the meetings I've had an opportunity to attend is that there are all kinds of federal programs and grants and resources and supports available to people in the faith-based sector who are looking to meet needs. Things like mental health first aid would be an example of that. If we have somebody who's watching today who might be pastor of a large church, or a bishop or someone who's leading leading a conference that covers a significant geographic area, and if they're if they're wrestling with ideas to serve, or if they've got some innovative kinds of things that they would like to do and wondering like how they can access help from the government or money, tap into like different grants that are available. How can your office help them with that? And what's the best way for those folks to make a connection?
Sure, I appreciate the question, Steve. We get that question a lot. Our office is not a grant providing office. We are more of a connection office. And so any grants that would support mental illness or support substance use would come out of SAMHSA, the Substance Abuse and Mental Health Services Administration. What we typically are encouraging local faith-based communities to do who are trying to step into either of those two spaces, the addiction space or mental illness, is to reach out in their own community. Have you visited the federally qualified health center in your community? Have you visited the local hospital? Local hospitals have community funds that they have to use. And so your local hospital might be able to provide a sub-grant support that would provide assistance if you're doing something in your community that does meet that public health need. So we really encourage our local faith leaders to get out into their community. Of course, that's what we're encouraging, to get out in the community to meet clinicians as well. I think so many of our faith leaders tend to stay in the four corners of their walls. And, COVID has completely obliterated that possibility. For most faith communities at this point, we as faith people are being forced outside of the doors of our local churches, our local faith communities. And in the midst of this season, I would encourage your faith leaders who are attached to Key Ministry, meet with the local hospital, meet with the federally qualified health center. Meet with your local chamber of commerce. You should be getting out of the four doors of your faith community into your community, because there are a lot of grant dollars that go into communities, and you might be able to work with a grant recipient as a subrecipient to serve certain needs.
Well, I know.
And here's Steve. There are organizations I know all over the country, and Shannon, I'm sure you're aware of many of these, that focus on the health needs of a particular area, and they often have robust information about the specific local needs, health needs, housing, transportation, all those things. And if I can just encourage those who are watching to think of mental health ministry as not just connecting somebody to a counselor, but thinking about how to meet some of those practical and tangible type needs that people have that can just add so much stress and anxiety and lead to crisis in their lives. So that's really a place where churches can step in.
Absolutely. And I think you're right, Catherine, that look, if the nation as a whole is experiencing the anxiety of COVID, imagine someone who actually has a clinical diagnosis of anxiety. You know, what level of anxiety they're struggling with through this season, with all the uncertainty and all the unknowns. And is their family safe, and are they safe, and can they go to work, and all of those kind of questions. I think we're really at a moment where the faith community can engage, the church can engage to step into some of those places.
Well, Shannon, you and I had met before you went into government, and I know that for a very long time you've been a champion for families with all kinds of disabilities, and in particular mental health disabilities. I was delighted when I heard that you were going to have this opportunity, you know, to serve in this capacity in the government. Where's your passion come from for doing this? I mean, because it's clear that this is more than just a job for you and the people in your office.
Of course. Our family is touched by mental health concerns. And so I often say that I have that earned PhD without having the letters behind my name. I think families that have experienced living with hidden disabilities, whether it's autism or epilepsy, which is usually hidden until it's not, or mental illness, which is hidden until it's not. I think those families deal with a great deal of isolation and stress that really does call the church to step in and support and encourage. And so that's really where the passion comes from, the understanding. I'm a big believer that we're told that God comforts others through the comfort that he has provided to us. So he uses me and the life experiences I have had to provide comfort to other families. And that's a privilege.
That's awesome. I'm curious, is there anything, again, that there's been a very diverse group, you know, of faith leaders working on this topic. And is there anything in particular that would come to mind that Christian faith leaders could learn from folks from non-Christian traditions who've been serving in this area and trying to meet a need?
Yeah, I think that's a really good question. Wow, let me think about that. I think often our evangelical friends who are so faithful and diligent in being focused, in being faithful to the Word of God, which I come out of an evangelical background, and that is where my heart is as well, to want to be doctrinally sound and grounded in the Word of God. But I think at times their focus is so much on that they can miss seeing the heartache of people in their faith communities. And I think some of our friends who come from a more diverse kind of background or perspective, who maybe are not evangelicals in their biblical perspective, might be more sensitive to some of those human needs. And I think that's something that we can all learn from.
One other thing that again, through some of the meetings that your group has hosted, I've met a number of people in the historically Black church who have been doing some really interesting and innovative things,
Yes.
particularly in terms of breaking down stigma and trying to encourage folks within their community to seek out and take advantage of services that are available. During a time like when I think that we are particularly aware of systemic type issues where the Black community, has historically had challenges. Are there ways that you could see like the larger church coming together, in terms of, with all of its diversity to respond to some of the mental health needs, and where there's some opportunities for partnership between historically Black churches and Christian churches and organizations that are predominantly Caucasian?
That's a great question. I'll have two responses to that. One, our friend Dr. Sidney Hankerson, who is an African-American psychiatrist from Columbia University. He practices in New York and teaches at Columbia University. He has a really interesting approach when he is working with the African-American community. And that is, he says that quite often the African-American community doesn't want to acknowledge out loud mental health concerns. But he has found that if you talk about coping with stress, that everybody has stress. And so he has found that to be a way to open the door where people will actually come in to a meeting to talk about the stress in their lives. And it provides the opportunity to connect and establish relationship. I think that's brilliant, because I think there is, even though we have been doing this conversation for a number of years, Steve, you have, I have been engaging in this conversation, there still is a pretty significant stigma hurdle that many people fear. And I think the approach that Dr. Hankerson is taking is really brilliant, to talk about stress and coping with stress as a way to pry open that door, to give a little bit greater comfort, to provide some services and supports without necessarily using the mental illness language at the very beginning. I think that's a really interesting approach that he's taking that is being effective in his work in New York. I'm actually speaking this weekend to a mental health initiative conference in Atlanta, Georgia, that is an African-American driven conference. And I'm excited about it because I was on a conference call last night with the team of people who will be speaking. They're doing exactly what the guide is calling faith communities to do. It's diverse. Diverse from across many churches. It is involving different communities. So they've got the education community, the clinical community, the government, the faith community. They are actually doing what we've been talking about. And so I'm excited. I've just gotten to know them in the last couple of months because they invited me to come speak to their conference. And I'm really looking forward to getting to know how they're doing what they're doing more, and be able to share that with other communities. So stay tuned on that question. I'll get back to you on better how we can, as diverse churches and diverse communities, work better together on that. I'm very hopeful about that.
I want to throw out one thing. We shared that on our social media last week. So if you're watching this and you're curious about the conference, just go back, scroll back through the Key Ministry timeline just a little bit. We shared a link to register for that conference weekend.
And it is a free conference. It's 11 to 1 on Saturday. It's free. I think it's going to be a really good conference. I heard from each of the speakers last night in our pre-call, and I think it's going to be a good conference.
Wonderful. Well, and I just want to throw out one other comment came about language that's often helpful in Black churches is to talk about emotional wellness.
Mhm.
And so I think that that's another great approach, is to think in those kind of terms,
Sure.
as a way to pry open that door, which is,
We have to pry open the doors. Exactly. Or knock very gently.
yeah, exactly.
So I guess, like, to kind of wrap things up, with all the time and effort that the folks in your office and this very diverse group of faith leaders put into the resource, what's your single greatest hope as to what faith leaders are going to do with this once they have it in their hands, Shannon?
Yeah, Steve, I would like us 5 years from now to be in a very different place than we were 5 years ago. I think you and I have been working on this, and we've seen sort of where we were 10 years ago and where we were 5 years ago and where we are today. My hope is that a family considering the concerns happening, developing in their own home, that is kind of surprising and they don't understand it and they're trying to figure out what's going on, and they go to their pastor or their faith leader in the coming years, that faith leader will be so much better equipped to know how to serve that family and love that family well, because of the work that all of us are doing today. That would be my hope, that this would just be one more stepping stone. This simple tool that we created just will be one more stepping stone that equips the local church and the local faith communities of our nation to step in with a little more information, a little more compassion and empathy and knowledge to serve families who are living with these experiences.
That would be wonderful.
That would be wonderful.
So maybe we can wrap up and just, so where can faith leaders get their hands on the guide?
So James, if you want to go back to that last page in the PowerPoint, I think James is still there. You can download it from our website. Key Ministry has it on their website as well, but if you want to share our website with others, hhs.gov/partnerships with an S. You can also email us at partnerships@hhs.gov. We will at some point, in the midst of COVID, all of the meetings we had scheduled for this year have been canceled. So we have not actually printed this document right now. So it's a PDF available on our website, and you can just download that and use it freely. We hope that you will. Any questions that you have or any additional resources you know about that have not come to our attention that you think are helpful, we would love for you to share those with us.
Well, thanks, Shannon. Catherine, any final words?
Well, Shannon, just thank you so much for taking your time to join us today. We've had a lot of comments and people viewing this online, and I'm sure we will continue to have that. We will post that contact information in our description as well, so that people can quickly get to what they need. And we'll be sharing more about this in the coming weeks and months, because it is so important, and we do want to make sure that it's getting into the hands of the ministry leaders, just to equip them. So that they can deal perhaps more effectively with the challenges that we're all facing right now, but then also those unique challenges with mental health needs. So feel free, if you didn't get a question in today, feel free to reach out to Key Ministry as well. You can find me by emailing me, Catherine@keyministry.org, or go to the Key Ministry website and just fill out our contact information. We are continuing with our webinar series for the next couple of months on Wednesdays. So be sure to check the Key Ministry events page. That's keyministry.org/events to see what's coming up next. And we just encourage you to go ahead and register for our upcoming webinars that will address a variety of COVID-related topics, mental health topics, parenting and disability related topics. So we just encourage you again to go see what we have coming up over the next 8 weeks. So Shannon, thank you again for your time. Steve, thank you for joining us today. And for all of us at Key Ministry, we just appreciate you being here and look forward to seeing you again soon. Thank you so much. Bye.
Thank you.